Not one of these circles are bigger or smaller because we have given them all equal weight. What about the little circle on the left lower corner? The biology of the individual. What is your makeup? So what is it that you're taking? We don't believe you should just take anything. In fact, we believe it really needs to be very well structured. And we need to look specifically at your biology. So what is looked at is, what's your inflammatory process? There are ways to look at your inflammation. There are blood chemistry tests to look at your inflammation. What is your blood sugar amount? Because cancer cells like sugar. So we want to keep your blood sugar low. Cancer cells like a really inflamed environment. They grow better. They also like it when your immune system is pretty bad, because then they can kind of not have to worry about the natural killer cells and your T helper cells to kind of fight them off. They also like it when they can grow blood vessels, because, right, cancers get masses and tumors, so they need a blood supply. What about stress? Does stress have a play? I mean, I know I can feel less stress, but can I measure it? And if you look at it, your stress chemistry, high levels of cortisol have been seen with an increased biological terrain that's advantageous for cancer cells and not so advantageous for you. Melatonin, if you're not taking it, take it. Take fish oil. Fish oil lowers inflammation. I can tell you, take curcumin. Curcumin is a pretty amazing supplement. Ayurvedic medicine, if you like Indian cuisine, curcumin is a very good supplement. Again, it lowers this inflammatory process. Bromelain, which is a ginger-like, bromelain, which is from pineapple, which is an anti-inflammatory enzymatic protein, lowers inflammation. Boswellia is a ginger-like supplement. Again, lowers inflammation. Stinging nettles has antihistamine-like properties, lowers inflammation. We said ginger. And then there's your pharmaceuticals, ibuprofen, Celebrex. Those all lower inflammation. But we can look at your blood sugar level. We can look at it through hemoglobin A1C, so I can see what your blood sugar has been over a 3-month period. I can look at your insulin level. We can lower this. First aspect is diet. That doesn't work. Metformin is a pharmaceutical, works on reducing blood sugar growth. Glutathione. Glutathione with chemotherapy agents reduced neurotoxicity, sort of the tingling, the pain in the feet, the pain in the fingers from chemotherapy by 50%. What about improving your immune system? We actually have some pretty interesting food stuff out there that really does do this. And in fact, there's pretty good research on this. Medicinal mushrooms are probably one of the most highly looked at, and specifically turkey tail, or versicolor, Coriolus versicolor. It's probably the most well-studied. Beta-glucan is typically from turkey tail, and its ability to raise your white blood cells and your natural killer cells is pretty consistent. Very interesting, and there's actually research being done with medicinal mushrooms. Reishi, shiitake, maitake, those are some of the others, but the one that's most studied is turkey tail. So how many of you have undergone treatment and felt just sick, nauseous, like I can't even think of eating food? So feeling your best is I just want to have some soup and not feel sick. How'd that feel like? That feels pretty good. So is there evidence that there may be something other than Zofran, metoclopramide, compazine, Phenergan, that's pretty simple, really inexpensive, and if you like it, you could either take it as a tincture, take it as a tea, and if you don't like it, you can take it as a supplement. And that's ginger. And in fact, the studies on ginger, these are randomized controlled trials. These are the highest trials. Hackensack Hospital in New Jersey now uses on all their post-op patients ginger tincture. You know what they found? They've reduced the cost of their anti-nausea medication by 2/3. Because ginger really works. The only contraindications to ginger are if you have decreased platelets or if you're on Coumadin, it will change your Coumadin level. It actually tends to raise it, so you may have to lower your Coumadin amount. Ginseng is a very interesting herb. It's kind of used in a lot of additional supplements because you kind of use it because it adds. It has additive effects. L-glutamine, everybody should take L-glutamine. L-glutamine is a naturally occurring amino acid. It is the most prevalent amino acid in your body. And it is the most prevalent that's specifically in the gut. It's really good for gut repairs or anything that has to do with mucosa, whether it's from here all the way down.